Hello, welcome to my channel. This is Patrick. Today I am going to discuss colorectal cancer screening. I'm making this video because I have received a lot of questions on this, and I figured it would be helpful if I could just make a short video explaining colorectal cancer screening. So in this video, I am going to cover quite a bit. I'm going to look into what is actually colorectal cancer. I'm also going to investigate the genetic associations that are linked to colorectal cancer. Who is affected by colorectal cancer? When and how do you even screen? What food should you avoid? What signs should you watch out for? Okay, so it's going to be a short video, but we are going to touch on quite a few things that are very important when it comes to colorectal cancer screening. Let's get started. If you have been remotely paying attention, you would have by now known that colorectal cancer is pretty much on the rise. Okay, there are prominent figures who have died as a result of colorectal cancer. So it is the second leading cause of cancer-related deaths in the United States. This is a very lethal disease, and it primarily affects the colon as well as the rectum. It can happen sporadically or due to genetic disorder. Okay, so we're going to look at some of those genetic disorders that could predispose an individual to getting colorectal cancer. One of them is familial adenomatous polyposis. I always struggle to pronounce this, but I think I'm getting better at it. Again, familial adenomatous polyposis is a genetic disorder that has been shown to be associated with colorectal cancer. Another genetic disorder that has an association with colorectal cancer is Lynch syndrome. However, for the purpose of this video, I am going to concentrate on familial adenomatous polyposis. So this disorder happens when an individual has a mutation of the APC gene. The APC gene is a tumor suppressor gene, and when it is mutated, an individual can have familial adenomatous polyposis. Okay, so when you have that when you have the FAP disorder, you have that can result into hundreds to thousands of polyps. And if those polyps are not addressed, the individual runs the risk of having colorectal cancer as early as the age of 35. Once again, the FAP gene, right? The FAP disorder has a link to colorectal cancer. And this genetic disorder is as a result of the mutation of the APC gene. The APC gene is a tumor suppressor gene. So when it's mutated, the individual runs a risk of making hundreds to thousands of polyps. And if that is not addressed, your chances of having colorectal cancer increases as early as the age of 35. So you know what the colorectal cancer is. You know a little bit of epidemiology, and you know the genetic disorders that are linked to colorectal cancer. Who then is affected? So some medical conditions are gender specific. They might affect men more than they affect women. But with colorectal cancer, we have seen it in both men as well as women. We have seen it in all ethnicities. Okay? We have also seen it in both old and young people. So it doesn't know your age. It doesn't care about your ethnicity. It doesn't care about your gender. All right? So we're all in this together. Next, when do you start screening? All right? This is where I get most of the questions. When do you start screening? So if you are an individual and you have a family history of the genetic disorder that we discussed, the FAP disorder, all right, That means you have to start screening at the age of 10 using colonoscopy or flexible sigmoidoscopy. Once again, individuals with family history of that genetic disorder, they need to start screening for colorectal cancer as early as the age of 10 with colonoscopy or flexible sigmoidoscopy. And they have to continue screening every year until a definitive treatment is performed. And that is surgery. That surgery is known as colectomy. And that is when part of all your colon is removed. It is also recommended that even after the surgery is done, surveillance screening should happen because there's a risk of tumor developing outside of the GI tract. Okay, once again, this applies to the individuals who have the genetic disorder. But what if you are an individual who does not have the genetic disorder? When do you start screening? Okay, so according to the United States Preventative Service Task Force, we start offering the screening at the age of 45. And at the age of 50, this screening is now routinely performed. Okay, so you know the screening now if you have the genetic disorder or if you do not have the genetic disorder. So when another question that I always get is, what if you have a first degree relative with colorectal cancer? Okay, so first of all, who is your first degree relative? We're talking about your parents, your siblings, your children, right? So if a patient has a first degree relative with a history of colorectal cancer, the individual needs to start screening 10 years before that first degree relative was first diagnosed. For example, if you have a parent, if you have a father or mother who was diagnosed with colorectal cancer at the age of 50, this is saying that you need to be screened at the age of 40. So 10 years before they were first diagnosed. And you have to continue screening every 10 years until the age of 75. All right? Very important. So some people say, well, I don't have, but I don't like colonoscopy. What should I do? So the good news is there are alternative screening modalities that can be employed. So you can do an annual fecal occult blood testing. Because with colonoscopy, you have to go through a prep. Some people don't tolerate it very well. They have to clean your GI tract. You have to not eat for a certain period of time. You have a prep that you drink and it causes you to have diarrhea. But again, it's part of getting you ready to have colonoscopy, to be able to clean your gut, because they have to put a scope in there and be able to visualize and appreciate, right, the inside of basically your GI tract, right? So some people don't want to get colonoscopy because they have to go through that. Well, alternatively, you can do the annual fecal occult blood testing. Now, is it as accurate as colonoscopy? Probably not, but it's better than not doing anything. But the gold standard is colonoscopy. All right? So someone says, well, they only found, so if let's say you had your colonoscopy done, they only found one polyp. What should you do? So if they only found a polyp, just a single polyp, you have to follow up colonoscopy in 10 years. If they found multiple polyps, you have to follow up colonoscopy in 5 years. But if they found something that is known as the villus polyp, then you have to follow up in 3 years. The reason is pretty much because the villus polyp has a higher tendency of becoming cancerous. Okay? So that's the answer to that question. When do you stop screening? Okay? So the recommendation is you continue to do your screening until the age of 75 or until your life expectancy is less than 10 years. Now, if you are 75 years and you happen to be in good condition, you could pretty much have a conversation with your primary care physician to determine what is best for you. So at that point, it is now based on case by case situation, right? But the recommendation is that you can keep screening, keep testing until you turn 75 or until the life expectancy is less than 10 years. All right? So, what signs should you watch for? This is very important, okay? Because with colorectal cancer, sometimes you might not have a symptom. Okay, so that's why, again, when we talk about screening, it is really imperative. Not because we just want to subject you to some screening, but some diseases you may not find out until you get tested or until you get screened. So one of the signs to look out for is if you are starting to notice blood in your stool. Okay, under any circumstance, seeing blood in your stool is not normal. Now, it doesn't mean automatically you have cancer, okay? But that's something that is not normal. And sometimes all you just have to do is listen to your body, pay attention to your body, and recognize when something is abnormal. So it doesn't matter what situation it is, seeing blood in your stool is not normal. So that's something you need to pay attention to. Are you having persistent abdominal pain? Are you having changing bowel movement? Things like diarrhea, constipation. And you look at your stool, it is narrow. Some people describe it as pencil stool. Okay? If this consistently happens, then at that point, it is important for you to consider getting tested. All right? And are you losing weight? Okay? And I don't mean going to the gym or modifying your diet in order to lose weight and be in good shape and have a healthy body. That's not what I mean. I mean unintentional weight loss. Are you having incomplete bladder emptying? We call it tenesmus. That's where you go to the restroom and you just have this sensation that you're not fully emptying your bladder. And are you having things like fatigue, weakness, and anemia? Okay, so that's a sign, especially with anemia, iron deficiency anemia primarily. It suggests that you're losing some kind of blood. All right, so when you see these things happening, you need to take an action and get tested or get screened. All right. So next, what food should you avoid? One of the things, sometimes people get defensive about this, right? I know you love your alcohol, but it also does a lot of damage to your system. And I'm sorry to be the bearer of bad news. All right. So it's important that you cut down on your alcohol consumption. Smoking cessation, it's one of the best things you can do for your health. I need you to limit your intake of red or processed meats. Fried, starchy foods, not very good for you. And foods that are high in salt and added sugar. You need to limit your intake of those foods. On the other hand, it is important for you to for you to eat nutritionally healthy, incorporating things like fruits, vegetable, and fiber. Okay? Adhere to low salt diet, low carbs, and low fat. Okay? Very important. So that's it for this video. I just wanted to take this opportunity to go through some of these questions because I get asked a lot of questions, based on my previous videos, and people just want to know. So I hope this has been able to provide you some idea that will help you in terms of deciding about colorectal cancer screening. In conclusion, this is a disclaimer. I just want to make sure you understand that this is not a medical advice. This is for teaching purposes. If you have a problem, I need you to contact your primary care physician or go to the hospital. All right? Thank you for listening. Stay healthy and stay blessed.